Now, the Ministry of Health and Social Services has scheduled to conduct the National Integrated Vaccination Campaign, which is set to take place from the 8th to the 19th of August 2022. Joining us now is the National Immunization Program Officer at the Ministry of Health and Social Services, Mr. Nicholaus Shapumba, to give us more details on the matter. Sir, good evening and welcome to the show.
Good evening. How are you?
Good. Now, what is the National Integrated Vaccination Campaign all about?
Yes, it's all about providing service to the Namibian children and selected population groups. So what the ministry have planned is to do the integrated, like you said, integrated vaccination campaign, where we are integrating different vaccination and interventions. So the ministry is going to target the children under 5 years, where they will receive the measles and rubella vaccine. Every child that is from 9 months to 59 months will receive a dose of measles rubella vaccine. We will also screen the children of doses of vaccine that might have been missed. You screen according to the passport, and then you see that if they have missed one dose or two, you give them. So, but in addition to that, we will also give what we call the vitamin A supplementation to all the children between 6 months and 59 months. So they will get a tablet of vitamin A. And another intervention that we are going to give is the deworming. That is the albendazole that will prevent the worms in the child. So for that, we will give children from 1 year, which is 12 months, to 59 months.
Okay.
So now, in addition to that, now we are also going to vaccinate the Namibian people against COVID-19. Women of childbearing age will be screened for tetanus, diphtheria vaccines. So if you miss a dose, so you will be given that dose. And while for the pregnant women, we will also give iron supplementation for those that need them. So those are the interventions that we are going to look, but we are also going to screen children of nutritional status. We are going to do what we call the measurement of upper arm circumference, where you will measure and check if they are fine, they are not malnourished. If they are found to be malnourished, so we will give them the therapeutic food. So while for those that may perhaps be severely malnourished, they will be sent to the hospital for further management.
Okay, and this is basically a campaign that's helping out people.
Oh, sure. Okay. We are going to help out people out there.
All
yes.
right. Why did the ministry see a need to come up with this initiative?
Yeah, lot of things. We have not been doing very well with the routine immunization services. So our coverage has not been where we want it to be, especially for measles rubella. We are targeting to vaccinate every year, to vaccinate 95% of the children under 2 years, but we haven't gone there. So as a result, we have been getting some sporadic cases of measles disease. So if you are getting that, it means now your children are not protected. They don't have what we call the herd immunity. Hence now they campaign against the measles and rubella vaccines.
Okay.
So other intervention is part of the package that we want to give to the children, and including vitamin A supplementation and also the screening against malnutrition.
Yes. And you mentioned so many interventions that are including children under the age of 5. What is so significant about this age group?
Under 5 years, they are little kids, so they are vulnerable to diseases. In our routine immunization, we are saying we are preventing childhood diseases, so vaccine-preventable childhood diseases. So, and these are the children that are at risk of getting those diseases. They're also at risk of getting malnutrition. they're at risk of getting worms, intestinal worms. So that's why we are targeting them. We want them to be vaccinated, fully vaccinated, so that they are protected from childhood illnesses.
Okay, so talk to us about how the campaign will be rolled out throughout the country. Will this cater also to those people in remote areas?
Yes, before the campaign, of course, what I did not say is that the campaign is starting on the 8th and run until the 19th, so it will be a full 2 weeks campaign. So before the campaign, we had a meeting in Swakop. We call it a micro-planning meeting, where we brought together all teams from the regions and districts to consolidate their micro-plan. It is part of the planning processes, where we are looking at how they plan to implement the campaign in their respective regions and districts. So we look at the resources that they need. We look at the areas that they need to visit, because they have mapped the areas and look at where their people are, and so that when they deploy teams, they are deploying knowing where the majority of the children are, or where the hard to reach of the population in the districts are.
Right.
And so we are also going to have, of course, all the health facility will be vaccinating, but then you will have mobile teams that will now go out to some localities, either as an outreach team, but also in some instances as a mobile team that will move from one place to another.
All right. Thank you so much for joining us, Mr. Nicholaus.
You're welcome.
All right.
Thanks.
That was Mr. Nicholaus joining us and telling us about the National Integrated Vaccination Campaign that is set to happen from the 8th to the 19th of August. Don't go anywhere. The Daily Roundup continues after this. No can sit. Now, the month of July ended on a high note as far as entertainment is concerned. Various events catered to various demographics on the social calendar. Events such as the ever-popular Kasi Vibe that provides a space for small business owners and startups to exhibit their various goods and services had a 4-day extravaganza to keep the youth and the public entertained, whilst ensuring that businesses were well positioned for patrons to support. Another crowd puller during the weekend was the much anticipated annual Donkey Meat Festival. The 2-day event included a competition which saw various participants show off their culinary skills to determine who has prepared the best donkey meat dish. Musically, local hip-hop veteran Jericho gave fans a night to remember in the Omaheke's capital, Hobabas. These videos were provided by the attendees. Now that also wraps up today's edition of the Daily Roundup. Catch us again tomorrow, same time, same place. From me, Ndepewa Ambabi, and the rest of the production crew, thank you for watching and have a blessed evening.